am Dr. Ram Narayan, Senior Consultant Restorative Neurosurgeon, and today I'll be talking to you about a very common condition which is becoming more and more common and more dangerous, that is diabetic peripheral neuropathy. As we can imagine, neuropathy means involvement of the nerves, and diabetes can cause damage to the nerves of the peripheries, that is the legs and the hands. So this usually happens due to uncontrolled diabetes. So how does this happen? See, as we all know, all the organs in the body has a blood supply, and the nerves also need a blood supply. And these nerves are very small, pencil line like nerves, like blood vessels. And these supply the nerves going to the hands and the legs, especially the distal, the foot, the ankle, and the palms of the hand and all that. Diabetes causes damage to these small vessels, which we call microangiopathy. And when these vessels are damaged, obviously the nerves are affected. They do not get the necessary oxygen, glucose and all that for their activities. So it causes pain. In fact, diabetic neuropathy pain is also called as the cry of the dying nerves, because they are crying because they are all hungry, so they want food. But there is no way we can give food because there's no blood supply to the terminal portions. Over a period of time, the nerves start dying. So initially there will be pain, then there will be numbness, but over a period of time, everything stops. There will be no pain, no numbness. People feel happy that everything is gone, but that is the most dangerous part because that nerve is dead. So the functions associated with the nerve starts getting affected. Then this progresses and ends up in what is called a diabetic foot. That is, they get infections and which cannot be healed because you cannot put antibiotics there because there's no blood supply. They will not have any pain sensation, so they will get repeated injuries. They will not care about the injuries because there is no pain. So this is a complex situation where ultimately patient ends up having amputation of the feet. Diabetic neuropathy usually presents as foot as a glove and stocking type of paralysis. That is, it's like putting a socks on or putting gloves on in the hands. And this is the initial presentation. So how do you treat diabetic neuropathy? The best way to control diabetic neuropathy is to control the blood sugar. But studies have shown that even if you control blood sugar very well, some people still get the neuropathy. The other way to treat is nowadays by giving medicines like gabapentin and all, which reduce the pain sensation, but it's not actually the best treatment because they don't work on the improving the blood vessels. The latest treatment which is available nowadays is what's called a spinal cord stimulation. Spinal cord stimulation is putting a stimulator at the back here and putting a battery in front of the chest and stimulating. Once you stimulate, you work through the nervous system directly. That is, we call it the sympathetic system, and we open up the damaged blood vessels and cause collateral circulation. So that over a period of time, a new set of circulation is established and the blood supply to the leg and the structures of the leg, including the nerves and the muscles and all that, are established, so that there is no chance of getting non-healing ulcers and ending up in amputation. This surgery is internationally approved surgery. It is a US FDA approved surgery. Again, very simple surgery. It's almost a daycare surgery. You can get operated today and go home tomorrow. And it is there are a lot of studies which have shown that it's very, very effective in the correct patient. Thank you very much.